this video, we are going to be looking at the celiac trunk. Okay, so the celiac trunk can also be called the celiac artery, the celiac axis, and depending on the origin of the text, can either be spelt with an O or without an O. So we need to go back first of all and revisit the breakdown of the gut. So we have the foregut, the midgut, and the hindgut, and this is how it develops embryologically. Down the back of the abdomen, we have the abdominal aorta, which goes to supply the fore, the mid, and the hind gut through three separate branches. We have the celiac trunk, which supplies the foregut. We have the superior mesenteric, which supplies the midgut, and we have the inferior mesenteric, which supplies the hindgut. When it comes to biological variation, we are looking at one of the most diverse range of anatomical configurations seen from person to person. Now, when we're looking at the celiac trunk, you do not need to know every combination, but you should prepare yourselves for seeing slightly different representations of the anatomy during your time in the anatomy lab, or within textbooks, or online, or with your patients. Most of the anatomical abnormalities are largely benign and likely only relevant during surgical procedures of the foregut. So the celiac trunk, as we have mentioned, supplies the foregut. This is the stomach, the liver, the spleen, the abdominal esophagus, the pancreas, and the duodenum, but please note this is only partly. So the celiac trunk is a short artery that divides into three branches: the left gastric artery, the common hepatic artery, and the splenic artery. These can be remembered using the mnemonic left-hand side. So we have the left gastric, seen over here in pink, the common hepatic, seen in purple, and the splenic, seen in this lovely turquoise colour. Now the celiac artery is described as the origin. So all we have is this tiny little piece here, this very, very short artery, where these three branches come from, as seen in orange. So this is a representation of the celiac trunk, but we're going to break this down into more bite-sized chunks. So let's strip this back and take it on one branch at a time. Pause this video and copy out this image so we can go through it together. The first branch, despite it being the smallest artery of the celiac trunk, is the source of the largest variation. This is the left gastric branch. This can generally be found coming directly from the celiac trunk, but it also may come directly from the abdominal aorta. Once having branched from the celiac trunk or abdominal aorta, it travels superiorly and gives off esophageal arteries that supply the abdominal esophagus. After giving off these branches, the left gastric artery continues on its course around the lesser curvature of the stomach, giving anterior and posterior terminal branches to the fundus and body of the stomach. The left gastric artery does not terminate, but anastomoses with another artery, which we'll come back to look at in a minute. But in the meantime, that's the journey of the left gastric artery. The left gastric artery supplies the abdominal esophagus and supplies the lesser curvature of the stomach. It anastomoses with the right gastric artery and has a highly variable origin. The left gastric artery can be summarised as lots: left gastric, esophageal branches, and the terminal stomach branches. So let's strip all of that off again to tidy our diagram and move on to the next branch of the celiac trunk, the common hepatic artery. Hepatic, remember, means liver, so this branch is going to be the main arterial supply to the liver. As the branch travels to the right-hand side of the body, once it reaches the proximal part of the duodenum, we'll see it give off a branch. This branch goes to the right side of the lesser curvature of the stomach. This is the right gastric artery, and this is the artery that anastomoses with the left gastric artery, providing a high-pressure collateral circulation to the lesser curvature. The right gastric artery has a huge number of variations, just like its left partner. And as we move through the rest of the arteries, I'll point these out. Once again, don't concern yourself with remembering these variations. Just be aware that text you approach may have them listed in a different order. The continuation of the common hepatic artery is now called the proper hepatic artery. This is where the right gastric artery most commonly branches from. But the proper hepatic artery also divides into the left hepatic artery, which supplies the left lobe of the liver, and also where the right gastric artery may branch from too. The other branch of the proper hepatic artery is the right hepatic artery that supplies the right lobe of the liver. The cystic artery most commonly branches from the right hepatic artery and supplies the gallbladder, which is just that beneath here. Okay, let's look back at the common hepatic artery and look at another branch that comes from this artery. Not to be outdone by the left or right gastric arteries, this area also provides us with a range of anatomical variations. This Gastro-Duodenal branch comes from the common hepatic artery. Sometimes it can come from the proper hepatic. As its name suggests, coming from the Greek gastro meaning stomach, the Gastro-Duodenal artery will supply the stomach, in this case the pylorus, and part of the duodenum. From this artery we have this small branch. This artery is the supraduodenal artery, which, as its name suggests, supplies the superior part of the duodenum. Nestled within the first part of the duodenum, we also have the head of the pancreas. So branches from the Gastro-Duodenal artery, the superior pancreatico-duodenal arteries, will supply the head of the pancreas and the duodenum. This anastomoses with the inferior pancreatico-duodenal arteries from the superior mesenteric, which, as discussed at the beginning, supplies the midgut. The final major branch that the Gastro-Duodenal artery gives off is the right gastroepiploic artery that courses through the greater omentum and gives off branches superiorly to the greater curvature of the stomach, eventually anastomosing with the left gastroepiploic artery, which we'll come on to in a minute. So how can we remember the branches of the common hepatic artery? Think. Greedy reptiles produce seriously stupid gas. We have the Gastro-Duodenal, the right gastric, the proper hepatic, the supraduodenal, the superior pancreatico-duodenal, and the right gastroepiploic. Our final pit stop for the day is the splenic artery. This artery is probably the second most identifiable artery in the abdomen, aside from the abdominal aorta, due to its tortuous appearance. Because of its location, I'm going to dissect the stomach out so we can have a clearer picture. This long wiggly snake artery courses behind the pancreas, where it gives off 3 branches to supply the pancreas. The dorsal pancreatic artery that travels deep to the pancreas divides into left and right branches. This right dorsopancreatic artery anastomoses with the pancreatico-duodenal arteries from the Gastro-Duodenal artery of the common hepatic. The left dorsopancreatic artery continues as the inferior pancreatic artery. travelling, you guessed it, inferiorly to the pancreas, producing branches that penetrate the pancreas. The last of the three pancreatic arteries is the great pancreatic artery, which emerges from the middle of the splenic artery and enters the pancreas itself, travelling along the side the pancreatic duct to supply the tail and the body of the pancreas, continuing as the transverse pancreatic artery that forms anastomosis from branches of the inferior pancreatic artery. Let's get out of the pancreas now and re-enter the splenic artery. The splenic artery gives off a short branch that supplies the fundus of the stomach. Let's add that back in so we can orient ourselves. These arteries are called the short gastric branches and are found immediately before the splenic artery divides to supply the spleen. We have a collection of them, as can be seen here. The splenic artery then continues and divides to supply the spleen itself. Just before it supplies the spleen, it gives off our final branch, the left gastro-epiploic. We've met its sister artery along the way, the right gastro-epiploic from the gastro-duodenal. You would be right in thinking that these arteries anastomose and form the circulation for the greater curvature of the stomach and the greater omentum. The splenic artery is tortuous. It looks like a wiggly snake. It's the third most common site for abdominal aneurysms. That's after the common iliac and the abdominal aorta. It supplies the spleen, the fundus of the stomach, the pancreas, and the greater curvature of the stomach. We can remember this using the mnemonic, dig peas slowly like snails. We have the dorsal pancreatic, the inferior pancreatic, the great pancreatic, the short gastric, the left gastroepiploic, and the splenic arteries. Let's take away some key points to remember about the celiac trunk, as there can be an awful lot to remember. These configurations are highly variable. You do not need to remember them all. If you approach a text or image and you aren't sure what is what, follow the artery and see which part of the viscera it is supplying. For instance, if it's tracking around the right side of the lesser curvature of the stomach, you know it's the right gastric artery. Clinical significances of the celiac trunk. Splenic artery aneurysms. These account for 30% of abdominal aneurysms. We also need to consider peptic ulcers, particularly left gastric artery rupture from a peptic ulcer. We need to think about the collateral circulations that are involved, and therefore there is a high potential from a fatal bleed. And a slightly more rare but very interesting phenomenon is called celiac trunk compression syndrome, where the median arcuate ligament of the diaphragm compresses the trunk, causing severe and chronic abdominal pain, especially during expiration, when the median arcuate ligament becomes tighter as the diaphragm rises. It's rare, so it's unlikely you'll see this, but I wanted to use this as an example to show you how anatomy is not isolated. So to summarise the celiac trunk. The celiac trunk supplies the foregut. It is highly variable from person to person. The left-hand side is supplied by the left gastric and the splenic arteries, and the right-hand side is supplied by the common hepatic artery. So methods that which you can use to ensure that you remember this information. Create a flowchart displaying the astomoses and collateral circulations. Grab some pipe cleaners and Play-Doh, or even cut out paper organs and model your own flowchart. Draw the model yourself, testing your ability to remember collateral circulations and the main branches from which they come. Unfortunately, the celiac trunk repetition is the key to ensure that you are securing the information in your cerebral matter.